Hello, lovies. It is just me, Kim, here to go over another testimony rewind. And I'm trying to put on my button because I made it. And what a button it is. If you haven't seen it, I don't think I can say it on this platform appropriately, but we'll just say that's C and Nurse Kim. Okay. So there it is. Is it on? Look at her. Look at her. Sorry, guys. Woo! She's got it. Oh, Lord. Okay. Get over it. All right. Hi, lovies. Happy Sunday. It is October 27th, 2024, and we are ready. We were knee deep in the testimony of one Dr. Renee Stonebridge, yesterday, who sent us teleporting to another dimension, babes. And we loved it. We were obsessed because Dr. Stonebridge, babes, told us all the shit. And she said the quiet part out loud, and we know exactly what is going on. She let us know that there was catastrophic damage and traumatic brain injury to Officer John O'Keefe, which I don't think was harped on enough by the defense. They didn't even cross-examine Dr. Stonebridge, a quadruple board certified clinician who is incredible. And she let us know, babes, that there was not only subarachnoid hemorrhaging in the base and back of Officer John O'Keefe's head, but additionally in the frontal pole, as well as bilateral temporal temporal lobes, rather, and a left lateral plane. Okay? But the Commonwealth would like us to believe, babes, that there was a side swipe of Officer John O'Keefe by Karen Reed's 7,000-pound Lexus vehicle at 24.2 miles an hour in reverse, and that he struck his head on the ground from a standing at 6 foot tall to a ground level. Whether it was him striking his head, it was impossible that he struck his head on the road, right, on pavement, because how did he end up in the lawn, right? So if he struck the back of his occipital right cranium on frozen ground, how is it possible that we have such catastrophic damage to Officer John O'Keefe's brain? Riddle me that, my babes. And I just wanted to put this on because, look, we're going back to day 3 of the Karen Reed trial. And we are today going to go over Firefighter EMT Anthony Flemmatti's testimony, because this was a banger, babes. He was the head honcho. He was the head bitch, HBIC, if you will. And although Nuttall was very, very, he was a good paramedic too, but Flematti was the one who all of his information, he was the one who did the report. He was the one who did the handoff at Good Samaritan emergency room. And it's heavily important that you and that me and that we, babes, go over this together, and we're going to see exactly what was actually being reported in the field, what happened, how the assessments were made, and the decisions were made to treat Officer John O'Keefe. Get your Diet Coke, get your pins on, and potentially get some Haribo gummies, babes, because this is going to be a wild ride. Oh my gosh, let me see if there's humans here. Sorry, I just talked to myself for 5 minutes. Sorry. Hi. Oh, hi, lovies. Let's do all the things together. Thank you so much for joining me. I love your face. Thank you for answering a FaceTime on a Sunday with my crazy ass. Hi, John French. Love to see ya. Hi, Rosemary Silva. Hi, John. Friends love to see you. Oh, look. Whoa, whoa. Oh, my gosh. That was wild. I just heard myself. Hi, Lulu Bell. And let me see. And my BLT. Okay. Oh, and my Bolta. Hi, lovies. Oh, and such a pleasure. Okay. All right, babes. And look, this is for all of us, babe. Look at the fan. Did you not remember how much you missed the only fan? Stop it immediately. I can't help myself. I'm obsessed. I look at it. Ready? Let's let it just spin together. This cures insomnia, babes. And it's about to stop. We're watching the NBC News 10 stream, and we're about to get right into it. Let's all try to sleep well tonight after we go through this together. We're emotionally supporting one another, and a couple of gummies will make our way through. Oh, I gotta get my pearls. That's my Mimi.
Hear ye. All parties having anything to do with
Friggin' Jim.
First Justice Anthony Flematti, now sitting in the ghetto, Superior Court within the Fuller County in Norfolk. Draw near, give your attendance, you shall deserve it. God save the Commonwealth and this good court. Thank you.
Your Honor, this is 22-82117, the Commonwealth versus Karen Reed. Can I have counsel identify themselves for the record, signing with the Commonwealth?
Adam Lally for the Commonwealth. Good morning, Your Honor.
Good morning, Mr. Lally.
Good morning, Your Honor. Laura McLaughlin for the Commonwealth.
Good morning, Ms. McLaughlin.
Alan Jackson on behalf of Ms. Reed. Good morning, Your Honor.
Good morning, Mr. Jackson.
Elizabeth Little, also on behalf of Ms. Reed.
Good morning, Ms. Little.
Good morning, Judge David Yannetti for Karen Reed.
Good morning, Mr. Yannetti. Good morning, Ms. Reed. Good morning, jurors.
Good morning.
So I have to ask you those same three
I'm having
questions. Were you all
PTSD.
able to follow the instructions and refrain from discussing this case with anyone? Yes. Everyone said yes or not.
Oh my gosh, guys, can we just take a moment? I'm so sorry. You know how I know I shouldn't do commentary, but look at Bev's hair. Look how gentle and gingerly and sweet and caressing she was just in the beginning of this trial. Day 3, we still had hope, right? We came in, she had just gotten a blowout. She had just come back from being knee deep in clams down the Cape, right? And look at her. This was a good day. I digress. Let's continue.
Affirmatively. Were you also able to follow the instructions and refrain from doing any independent research or investigation into this case?
Yes.
Everyone said yes or nodded affirmatively. Did anyone happen to see, hear, or read anything about this case since we left here on Tuesday? No. Everyone said no or shook their heads. So, jurors, from time to time, I will give you instructions or talk to you for a few minutes about how you evaluate evidence. So I just want to take a couple of minutes today. It's part of my job, where my job is to teach the jury about the law. So in considering the testimony of any witness, please remember that questions are not evidence. Only the answers, which are in fact the only part of the exchange between the lawyer and the witness that are given under oath, are evidence. So if a witness is asked, isn't it true that after you learn that your uncle left you money in his will, you poisoned him? And the witness answers no. Based solely on that question and that answer, there's no evidence that the witness has an uncle, that the uncle had a will, that the uncle left the witness money, that the witness knew that he did, or that the witness poisoned him.
Oh, hi, babes. Just me. What the fuck? Do we remember this? I'm sorry, pardon my French. I don't remember this specific exchange where Judge Cannoni just comes flying out the gate and is going to clearly be telling our jurors that if a question is asked, and you know 100% that this is not towards her infant baby Jesus who suckled upon her teat, Adam Lally, but this is 100% towards Alan Jackson and David Yannetti, not even Liza Little. So this is outrageous. I do not recall this. And to say that your uncle is dead, he left you money in the will, you poisoned him. And she's saying there's no evidence of any of that. I live on an alternate universe. Universe. Send me to like, I don't know. Send me to Saturn right now and spin on the rings. Lord, hear our prayers.
So going forward, I want you to consider the evidence in that regard. Also, there were videos shown to you, and I expect that throughout the course of this trial, there'll be many more videos shown to you. These videos are evidence, and there's audio on these. So what the video shows is for you folks to decide, not me, not any of the lawyers. What an audio recording says is for you to decide, not me, not any of the lawyers, because you find the facts. That's your job. We all have different jobs, but finding the facts in the case is your job. Okay? So with that, please get the Commonwealth's witness back on the stand, Mr. Flematti. Jim, swear in again, please. Thank you.
Just watch your step forward. I just need you to raise your right hand one more time. Do you solemnly swear the evidence you give the court and jury in the case now and hearing should the truth, the whole truth, and nothing but the truth, so help you God?
I do.
All right, Mr. Lally, whenever you're ready.
Now, before I begin, may I just approach the witness to return exhibit 1?
Sure.
Hey, Your Honor, may I please do the job that I should have done before? Yes, absolutely. Absolutely, Mr. Lally. All right, here is Anthony
Good
Flematti.
morning. Now, Firefighter Flematti. When we had left off the other day, you had arrived in the area of 34 Fairview Road, is that correct? Correct. And when you arrived there, what, if anything, did you do upon your arrival? So on arrival, positioning the apparatus is going to be our most important thing, trying to figure out where our patient is and parking our apparatus close enough, especially at nighttime, that we can light up the scene as well as we can. Try and figure out how to approach a scene, because if we have to trek equipment farther distances, it can slow our response down. So we try and make sure our
Apparatus, guys, clearly means my apparatus is our ambulance.
arrival and positioning is as best as we can put it.
And as far as positioning in reference to when you first are sort of pulling up on the scene, where are you in the ambulance again?
So I would have been the passenger of the ambulance. Usually the tech that's leading into the call will sit on the passenger side to try and mentally get ready for what's going on, whether it's reviewing protocols or just trying to assess the information coming across the radio so you can update your treatment plan as much as you can before you even see the victim.
And when the ambulance comes to a stop where it's parked at your position, where is, what if anything do you see sort of as far as the scene is concerned?
So we have our fire apparatus that are helping light up the scene, but we also have two female parties going by to the victim on the side of the road and going back and forth between that person and the side of the road.
And from the position when you first arrive, are you able to see the person on the side of the road?
You can see a shape of a person, so we know that's where the patient is, because we reported that there was a party on the side of the road. So seeing a body shape, that clued us that that was where we were headed.
Okay, guys, let the games begin. So we've already said that the apparatus, thank you, Pierre, is arrived at the scene. We have Anthony Flematti, who is in the passenger seat. He is running this entire operation. He is the tech in charge. And he is basically like preparing himself emotionally, mentally, spiritually to go where he is about to go. All of us do this. If there's a code or anything that you are going to have a traumatic response to, and that you're responding as a healthcare provider, you need to get yourself together as best as you can because you have to be in the zone. So that's what he was doing. He says that upon pulling up to the scene, he sees two broads walking back and forth in between, right from this where the shape of a person was and into the road. Okay, so we know that that's Karen and Jennifer McCabe, and that he saw what appeared to be a shape of a person, right? He didn't know who it was, what it was, etc., but it was a shape. That's in direct contrast to the testimony of whom? Jennifer McCabe and Carrie Roberts, because they would like us to believe that Karen just jumped out of a moving goddamn vehicle and ran to something when they didn't see it. But Anthony did. Okay. Continue, good sir.
In addition to the ambulance that you're in, how many other vehicles are on scene when you get there?
When I get there, I believe it is engine 3 and car 5.
And beyond sort of the vehicles from your department, what, if any, other vehicles do you see when you get there?
If I remember correctly, it was just a personal vehicle. I don't remember if there's any police cars on scene at that time.
And from your orientation when you pull up, where is the body positioned? To your left, your right, or something?
To my left.
And so after the ambulance is positioned, what do you do?
So then it's going to be bringing all the equipment over to the patient's side to be able to extricate them from that situation, whether it's a house or a street or a road. We assess where they are and then the best tools to get them out into the ambulance to be able to work effectively on the patient.
When you proceed over to, now again, at some points subsequent later on, are you able to identify who the person on the ground is?
Yes.
Bolton, my lovey, that was actually Timothy Nuttall, who thought he saw the big puffy coat.
We will try and get a general idea of the age of the patient, the positioning of the patient, how they were found, and then when we get them into the ambulance, we can start identifying ways to register that patient in the emergency room. So identifiers, whether it's a license or witnesses, or we try and figure out who they are so they can get registered at the hospital.
And at some point, were you able to identify who this person was?
That's correct. His wallet was in his pocket, and we were able to grab his license.
And who were you able to identify?
That was John O'Keefe.
And so, with reference to Mr. O'Keefe, when you first observed him on the ground, how far away from the street or the roadway is he at that point?
I would say approximately 10 feet away from the road.
And how?
Woo, woo, ding, ding, ding. Okay, this is just a reminder, guys, that we are going to pull out things that are different. One of these things is not like the other. Do a dance, queen. Do a dance. So now, Firefighter Flematti tells us that the body of Officer John O'Keefe was approximately 10 feet from the road. Keep that in mind.
How was he positioned as far as how was his body positioned on the ground?
I'd have to review, but I believe he was supine on his back.
Just in general terms, first, when you're responding to a call of this nature, what are some of the protocols or that you were speaking about? What is it that you're seeking to do or assess when you first arrive?
So we're trying to determine if it's a cardiac arrest, whether it's a viable transport or workable arrest. We have certain protocols within the Massachusetts protocols for whether we work the patient or we leave the patient on scene. If it's a police matter, if there's.
Okay, guys, sorry, I didn't mean to cut him off, but I just wanted to tell you because we talked about this yesterday when we were going over the testimony of Dr. Renee Stonebridge. And I said that Anthony Flematti, the head of this entire call, said that Officer John O'Keefe met criteria to be worked on. So he was not pronounced at the scene. If he had had multiple signs of being unalive for a significant amount of time, there are specific check marks and criteria. It would have immediately gone to the police for Canton PD, but they as we will find out, did find Officer John O'Keefe as a viable resuscitative event.
This injury is non-sustainable with life. So we're trying to make that assessment before we make any decisions.
Let me stop you there just for 1 second. You do use the term as far as cardiac arrest. Based on your training experience, what do you understand that term?
So cardiac arrest, to the best of my knowledge, is just the cessation of electrical and mechanical activity in the cardiac muscle. So the cardiac muscle pumps blood throughout the body, and when that stops, all life stops after that.
Now, in particular reference to the conditions, the weather conditions that you find yourself in, what, if anything else, is sort of on the scale or spectrum in regard to diagnosis of this?
So cardiac arrest, depending on where they're found, we try and figure out what led them to be at that point. So we're looking at weather conditions as well. That can also affect viability of resuscitation. So due to the extreme weather, extreme cold, we'll attempt resuscitation on that patient due to the fact that it'll prolong viability of the arrest or ability to recover from cardiac arrest afterwards. So weather is definitely a key factor in where they're found.
And you're familiar with the term based on your training experience called hypothermia?
Correct.
And so what, if any, sort of relationship does cardiac arrest have? Well, let me ask you this first. What is your understanding of the term hypothermia?
The exposure to extreme cold that lowers your core and extremity temperatures down to below 95 degrees, usually.
And what, if any, interplay is there between hypothermia and cardiac arrest?
So like I said before, it'll prolong how long, it'll preserve the body after arrest. So if somebody's found in like a cold water situation, there's been multiple reports of patients recovering after being drowned in cold water for up to an hour. So viability is definitely improved by the cold weather.
And so what that is, lovies, is that we have a kind of blessing and a curse of what occurred, right? Is that we know that the lower temperature between 18 and 22 degrees on January 29th, 2022 into the early morning hours was preserving Officer John O'Keefe and allowing a potential for there to be resuscitative efforts when there might have not been if it was a not such a cold evening, because like he is saying, there are specific medical examples of being in hypothermia and being able to come back from a cardiac arrest because everything is slowed down in the cold, right? Our vasoconstriction occurs. We have vasodilation getting larger, and vasoconstriction is only preserving our brain and our respiratory and organs, and the tips of our fingers and our toes and our legs would not receive blood flow. It would just try to keep into survival of the body. Continue, good sir.
And as far as viability is concerned, you talk about doing your assessment. What are sort of the steps that go into your assessment?
So we're looking at obvious signs of death. So we're looking at exposure of brain matter. We're looking at traumatic injuries, decapitation, things that would basically be non-life sustainable. We're looking at signs of lividity and rigor to basically show us how long the patient has been down for.
And
Ding, ding, ding. Another alarm bell should be going off in our beautiful, smart, and pretty heads. So Anthony Flematti just said to us, we're looking for signs of lividity and rigor. That is, lividity would be the pooling of blood that occurs at end of life, well, not end of life, at post-mortem, okay? That is an obvious sign of death, as well as rigor, which is the stiffening of body, and none of which were present in Officer John O'Keefe at 6 o'clock in the morning on January 29th, 2022.
the age of a particular patient, what, if any, relationship does that have to your assessment?
So it'll show the extent of frailty the patient has. If somebody's an elderly patient, severe cancer patient, their ability to sustain a cardiac event like that is less. So somebody that's younger or middle-aged will have a much better chance of recovery afterwards. But that would really be the only key that we're looking at.
And what, if any, observations did you make of Mr. O'Keefe during your assessment of him initially?
Just that he was a middle-aged male, and that was all we had.
And as far as the other things that you were talking about, as far as viability or resuscitation, what, if anything, did you observe with reference to Mr. Keefe in regard to that?
So with viability, we were looking at any rigidity or rigor in the body, or lividity or separation of blood. You would have a pooling of blood or bruising, it would look like, at the lower parts of the body, depending on how the person's positioned. Basically, if they're supine, you'd have positioning or pooling underneath the body. And then you would have stiffness of the arms, legs, jaw, neck to be able to move the body. We're looking to, if they don't have those things present, it's another check mark of saying this is viable, we can work this.
And specifically as it applies to your assessment of Mr. O'Keefe, what, if anything, do you recall in regard to that initial assessment as far as viability?
So his limbs were able to be moved, jaw was able to be moved. The posterior of his body was red. So
Ding, 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 ding. Are you shitting me? Okay, guys, I want us all to put our Grey's Anatomy caps on, put our real life experience on, okay? And I want you to hear and listen or remember exactly what Anthony Flematti just told us, that the back of Officer John O'Keefe, where he was supine on his back in a lawn at 34 Fairview on January 29th, 2022, his back was red. Red, okay? And that all of his extremities were pliable and movable, and that his jaw as well was all able to be moved. Riddle me how, if Officer John O'Keefe was struck by a vehicle and left unalive for 6 hours in degrees that are below freezing, 32 degrees Fahrenheit, between 18 and 22 degrees that night for 6 hours. Remember, it is not asked that there was no signs of frostbite, because good old Anthony Flematti would have wrote it. So what this tells us, babes, is that we're looking at this and going, either he was not struck when they said he was, or Officer John O'Keefe is potentially an alien who has blood that boils for hours and hours, unlike any other human being. He might be half Terminator, because this does not medically add up. This is one of the biggest question marks in the medical testimony that was provided by the Commonwealth of Massachusetts, in my humble opinion.
not the indicative of lividity that we're looking for. So we termed it to be a viable arrest and continue to work.
You mentioned, as far as sort of gathering your equipment, bringing it over to Mr. O'Keefe, what, if any, equipment did you gather?
So equipment initially is going to be our scoop stretcher to be able to pick the patient up, break apart, put it underneath him. We have our first in bag, an airway bag, cardiac monitor. We'll bring all that over to the patient's side to be able to do as much as we can in that situation. But due to the weather, we wanted to get him out of the weather, because that was one of the things that was hurting him at that point, is getting him into the warmer ambulance and beginning the warming process. So get into an area where we can assess the patient thoroughly with good lighting, and to be able to expose the patient, begin the warming process.
And when you go over to where Mr. O'Keefe is, about 10 feet off the roadway, who, if anyone, from your department goes along with you?
So I have Matt Kelly with me and Tim Nuttall. I also have Frank Walsh, Katie McLaughlin, and Greg Woodbury, and Captain Robbery.
And As far as this sort of initial assessment on the ground with Mr. O'Keefe, what, if anything, were sort of each of those respective people doing with regard to Mr. O'Keefe?
I'd have to review specific interventions as far as who did what, when. But that's why we document things immediately afterwards, so it's all fresh. So CPR was initiated by me and ALS assessment as well. So I can go over individual interventions if you'd like, but it's really your call.
And for the record, sir, you're looking at exhibit number 160, and what page of that are you looking at?
It says 205 of my EMS report, but there's also the NFIRS report on the top as well.
So initially, when you go over to Mr. O'Keefe, how many other people are sort of in that area at that time?
So in the area, we have the first responders, and then we have the 2 female parties on scene.
Where were the 2 females in relation to Mr. O'Keefe?
There also was Canton Police Department. Remember that, Levies?
So as we're approaching the scene, they were kind of in between us and the patient. So we tried to gather as much information as we could from them as we could.
So once you make that determination as far as viability of resuscitative efforts, sort of specifically, what are you and the other firefighters doing in regard to those efforts with Mr. O'Keefe?
So we're beginning CPR. We're trying to establish good quality CPR, get the patient onto our stretcher, begin an IO, start medication, start ventilating the patient. All this, all of the conditions that the body has, we're trying to remedy through intervention.
All right, my little loves, I just want to go through what all of this is. He'll go into more detail, but let's do a rundown. Let's do a Nurse Kim medical codes for the non-medical professionals, right? So here's what happened. They took Officer John O'Keefe, started providing quality CPR, okay, huge. And then they got they started an IO, which is in the front, or like this is going to be a line that goes through to be a main line, okay, in your leg, because there was no way that they were going to be able to, it's an intraosseous, and this is the gold standard of care for hypothermia. They needed to warm him and push these warm fluids through him in order to give him the best chance of resuscitative efforts and to bring him back. Now, what they didn't do is try to start a peripheral line, because Timothy Nuttall, because Anthony Flematti are not idiots. And do you know what, when we talked about before, how when you're vasoconstricting in a hypothermic event where the freezing temperatures have your vessels are closing, and only in a survival mode, which is oxygenating your brain and your organs only. Everything else is kid shit, is not available. And it would never be that a peripheral line would be started on someone without a pulse. Okay, thank you. So when you're looking at Officer John O'Keefe's hand, and when some specific commentators, Jennifer Coffindaffer, said that there was a pinprick right here that indicated that there was a peripheral line attempted, that is 100% incorrect. Do not listen to, people that think they know something and have no clue, okay? And if we listen to Anthony, he's going to tell us that they didn't do that either, okay? So let's all just use our brains, because we're the smartest and the prettiest. Clutch those pearls. Let's go.
So we're trying to breathe for the patient. We're starting to press on his chest to do CPR to cause his cardiac muscle to compress, spread blood through the heart, cardiac muscle, cerebral brain. And we're trying to reverse what's happening in the body.
Now, as far as when Mr. O'Keefe, you observed him on the ground, what, if any, snow did you observe on or around him in that area?
So the snow was probably up to the mid-axillary point. So we're looking at probably halfway up his rib point. Top of his body was clear.
And do you know about how much?
Interesting, guys. I'm sorry. I'm going to stop cutting him off. But he said that there was snow to his axillary area. Would be under your armpit, but that the top of him was clear. Okay. And that's interesting that he picks that spot because yes, we know that snow was removed from Officer John O'Keefe's face, but that was because he's laying down and snow was falling upon him. That would probably be indicative of probably 2.5 inches, like we have said as Karen Reed supporters for a very long time. It was never 6 or more inches, as has been alleged by other individuals that were at the scene, stating that this was such a significant snow event by the time they arrived on the scene, that's why potentially different evidence was missed, i.e. 45 pieces of taillight.
Snow was covering his body up to the mid-axillary.
I'd say probably about 4 inches, 4 to 6 inches.
Now, as far as your observations, Mr. O'Keefe, when he's on the ground, what, if any, observations did you make as far as how he was dressed?
For the exposure, I'd say he was pretty underdressed. Long sleeve t-shirt, jeans, nothing really substantial to be out in that type of weather.
And at this point, or any subsequent point, what, if any, observations did you make of Mr. O'Keefe's footwear?
By the time so our first priority is obviously going to be treating the patient. His clothes do matter, but it's on the list of priorities, not huge. So by the time we figured out he was missing one of his shoes, we were already at the hospital at that point.
And do you recall which of his shoes he was missing?
I don't.
And as far as
Sorry, but I'm just saying, that maybe should have been something you documented. Do you remember which one of the shoes? Yeah, I'm the lead EMT on this call. I should have known even when I got there to document that afterwards. Just saying.
that missing shoe, was that something that you or any of the other firefighters, paramedics would have needed to have removed on scene pursuant to any sort of treatment?
Nothing would have been done through the feet. It would have been just exposure of the patient to see possibly the extent of frostbite, if it had started affecting his extremities, fingers, nose, that type of thing, of hypothermic reaction there.
Would that be something that would have been removed by one of you or one of the other firefighters while he was on the ground?
If it would have been removed, both of them would have been removed to assess that. It wouldn't do much good to just remove one and leave it there on scene.
Now, as far as the two females that you observed, did they?
Oh my gosh, was that the only mention of frostbite that we would have potentially taken off the shoes in order for us to assess for frostbite? And then we wouldn't have just taken off one shoe. Oh, Jesus, take the wheel.
They sort of remain in the same position you initially observed them? Did they move around or something else?
They kind of cleared a little bit away from the scene. I would say they moved off to the right of the apparatus so we could work on the patient at that time.
And what, if any, conversation or what, if anything, did you ask either of those two?
So how the patient was found and what brought them to that situation is critical. So we're trying to figure out as much information past medical history that we can of the patient. So we're trying to find somebody who has knowledge of the event. So as we approach the scene, begin to talk to one of the females. What is going on? Why are they there? Just what happened.
And you say you're speaking to one of the two females, is that correct?
That's correct.
You see any of those females in the courtroom today?
That's correct. Miss Reed.
Could you just identify as to where Ms. Reed is seated or an article of clothing?
Right there.
I can only just ask the record reflect identification of this.
Okay.
Now, with regard to one of the two females that you were talking to, was that Ms. Reed or was that somebody else?
That was Miss Reed.
And why, if at all, were you talking to her versus one of the other females that you observed?
She seemed to be the one that was most personally affected by it, so figured she'd had the most information about why the person was there.
Okay, guys, sorry. I'm so sorry. You're going to kill me. But listen, so that is a very interesting take from Anthony Flematti, saying that he spoke with Karen Reed because she seemed to be the most personally affected by this trauma scene that he has come upon. For me, I would be the exact opposite. I would never talk or try to get information out of the most hysterical person on the scene, because that doesn't make sense for me as a medical provider trying to gather information. I am going to go to the calmest person at the scene because they're there together, and you're going to be able to give me the same amount of information, even as maybe even a bystander, than a hysterical human being, as hysterical as Karen was that morning. Just for me.
And what, if any, observations did you make of her in regard to your conclusion that she was the one who seemed the most personally affected by it?
She was the most distressed on scene, obviously upset, so personally related to or had a relationship with the person.
Before we get to any conversations, what, if anything, did you observe Ms. Reed or any of the females doing with reference to Mr. O'Keefe's body when you first started to come up to the scene?
So I would characterize it as an attempted resuscitation. She was attempting to do CPR, but due to the erratic behavior, she was running back and forth between the other female on scene and the body, back and forth, trying to press on his chest, wake him up, talk to him, just to no avail.
Okay, guys, this is interesting. So now he said she was trying to, attempting to do resuscitative efforts. This is Karen, okay? And that she's going between another female on the scene. Where is the third female? Where is Kerry at this time? Because I believed that Kerry was over providing or assisting or aiding Karen in those resuscitative efforts. So that's interesting, and it's good for us to hear this again.
And as far as your conversation with Ms. Reed, what, if any, questions did you ask in regard to the demographics or anything else?
So do you have any information of who this is? How are they here? Tried to get any type of information we could from her at that time, but with no luck.
When you say with no luck, what, if any, response did you receive from Ms. Reed in regard to your question?
So the only response that I was personally given was just, I hit him. Oh my God, I hit him.
And when she's saying I hit,
I hit him. Oh my God, I hit him. Well, let's just break that down a little bit, babes, because that is not the 3 I hit him that was reported by, allegedly, Jennifer McCabe, and also by Kerry Roberts, right? Did Kerry say that? Might have not been Carrie, but definitely it was Katie McLaughlin. And so did Timothy Nuttall. Those 3 paramedics. We have Flematti, McLaughlin, Nuttall, all said, I hit him. We're going to find out later that there's no documentation of what they're remembering, but that is not consistent in the way that the 3 times I hit him, I hit him, I hit him. Remember this picket signs, guys. She told us, we believe her. Okay.
Hit him, I hit him. Oh my God, I hit him. How loudly is she saying that?
So she was within 2 feet of me, but very loud. Any type of follow-up questioning, did you hit him with your hand? Did you kick him? What happened? She just repeated the phrase over and over again, I hit him, I hit him.
Okay, babes. Now, this is huge too. I remember this back from when I was watching this initial trial. This was, I believe, on May 2nd, 2024. And what we did was blackout when we're watching this because Anthony Flematti tells us, he says the quiet part out loud, babes. There is nobody who is at that scene, whether it be Canton Police Department, fire, rescue, anybody. They all believed if Karen said, did I hit him? Could I have hit him? That Karen Reed punched him, slapped him, domestic assault. No one thought he was hit by a vehicle. And that is 100% true. Thank you, Anthony Flematti, for saying it.
And just to be clear, where does this conversation occur?
This was as we're bringing equipment over to the patient. The interventions are going to be started basically by whoever gets over to the scene first. I'm trying to gather information as a lead paramedic to try and coordinate interventions and therapy to kind of holistically be the team leader in that situation. And
are you kidding me? Are you kidding me? I just was muted. I'm sorry, lovies. So I don't even know, what was I saying? Oh, he said that this conversation happened while he was on his way over to Officer John O'Keefe to provide the life-sustaining measures to him, right? So we know that there is dash cam. So we want to keep that in mind, that he said that the conversation with Karen Reed occurred while bringing equipment to Officer John O'Keefe. Let's go.
treat and transport the patient. So it was on approach to the patient, probably halfway between the ambulance and the patient.
And with regard to that treatment of Mr. O'Keefe, I think you referenced it earlier being within your report. What were sort of those steps or what, if anything, did you and the other firefighters do with regard to treatment? Before you answer that, Your Honor, may I request, may the witness just refer to his EMS report as it goes?
Yes, if need be.
Thank you. So we try and document through our flow chart of all of the interventions that we're doing. So CPR is obviously going to be our first priority. CPR is initiated, unchanged but successful in the actual intervention itself, no complications. We do our ALS assessment that we talked about of any further indications of this is not a viable arrest. We determined it was a viable arrest and we move on. Then we're going to start, we refer to it as a bag valve mask at 15 liters per minute on oxygen. The patient's not breathing on their own, so we're trying to assist ventilating that with high flow oxygen as well. And easy IO, which is a needle we put into the bone of the tibia of the patient. That was on the right tibia was the first one we put in. We're going to be putting in warm fluid. We have a warmer in the back to be able to bring up the core temperature. Then we start with epinephrine, 1 milligram through that IO.
If I could just stop you there for 1 second. When you say as far as IO and put it into the leg, how is that sort of inserted into the leg?
So we have two different methods we can do. We have a drill, a power drill that drills through the outer layer of the bone into the capillary area of the bone, the soft but spongy material. So we drill through that, or we can do it by hand if that fails.
And when you come
Fast fact, when I was just a baby nurse and I was actually going through clinicals, I literally, guys, telling you this, no shit, no word of a lie. Your girl needed some fucking Skittles, okay, when I did ortho, because when I walked in and saw craftsman tools that you could have gotten from Bob Vila and Sears, I was like, oh, she's going down. Literally, I am actually fainting. Ortho is not for me. Bone drilling, absolutely not. Back to business.
comes to the epinephrine, what is sort of the purpose of that medication? What are you trying to do with that medication?
So that medication will improve, it's a vasoconstrictor. It'll cause the vasculature to constrict. So it'll improve the quality or effectiveness on the cardiac muscle, cardiac vasculature, and the cerebral area.
So as far as the administration of epinephrine is concerned, is that something that's done once or more than once? And is there a protocol for that?
So it's going to be serial every 3 to 5 minutes during the cardiac arrest to try and bring them over to the hospital so it continues that entire time unless there's a rhythm change or that can change our algorithm of how we approach the patient if there's a rhythm regain or return of spontaneous circulation.
And so how many times or what times was the epinephrine administered via the IO to Mr. Oates?
Okay, so I have epinephrine at 620, 625, 630, 635, 640, 645.
And when was that first admitted? Was that at some point when he was outside of the ambulance ground or in?
It would be dependent on transport time.
See, babes, I'm loving this. This is what we want. We want all of this is facts. Facts matter, journalism, okay? Zero opinion. This is what happened. This is how the events occurred. And this is so important for us to go back and get medical facts because, yes, witness testimony gets wild and wacky, but documentation of medical professionals is the most reliable source that we have to deduce what in the actual fuck happened on January 29th, 2022. Clutch those pearls, pardon my French. Love your face.
So we're at patient side at 6:15, transport 6:27. So best estimation would have been inside of the ambulance at that point.
I'm sorry I interrupted you before, but after sort of the introduction of the epinephrine, what if anything, did you and the other firefighters?
After the first round? Yeah. So first round of epinephrine. After that, we would drop in what's called an OPA. That would be to push the tongue out of the way, open up the airway to improve our bag valve mass so it has an open air way to get the oxygen into the lungs. We begin external warming, stripping the patient, getting the heat turned up in the back of the ambulance. We would then switch over from manual CPR done by hand to a mechanical CPR device to ensure adequate, consistent CPR compressions of the chest. It was a Lucas device. Put that on the patient. And then we continue with another round of epi. Patient's starting to warm up at this time, so we would do suction at that point to try and suction fluid out of the airway to improve ventilation efforts. Another round of epi is done.
They did 6 total.
We have another suction this time through a deep suction via the endotracheal tube. Sorry, at 6:22 after warming, we intubated the patient. We have a 7.5 tube paced at 27 centimeters, and then verified through various means, through chest rise, auscultation, waveform, and tidal CO2.
Good.
So we had complications listed as patient vomiting, aspirating. Suction was then done with a rigid tip suction device. After successful intubation, we then suctioned via French
Wait.
tube through the.
I'm sorry. What did you just say? Did you just say that he aspirated and vomited? Officer John O'Keefe? Hold, please.
Patient's starting to warm up at this time, so we would do suction at that point to try and suction fluid out of the airway to improve ventilation efforts. Another round of epi is done. We have another suction, this time through a deep suction via the endotracheal tube. Sorry, at 6:22 after warming, we intubated the patient. We have a 7.5 tube paced at 27 centimeters,
Normal.
and then verified through various means, through chest rise, auscultation, waveform, and tidal CO2. So we had complications listed as patient vomiting, aspirating. Suction was then done with a rigid tip suction device. After successful intubation, we then suctioned via French tube through the airway established.
Oh, Levies. We heard that twice. Okay. Okay. So this Anthony Flematti documented that they had a complication while they were, like, after they had intubated. Okay. And stating that Officer John O'Keefe vomited and aspirated, and they had to suction again. Huh. Okay. Okay. I don't. Oh, that is wild, guys. I don't even have any words to speak right now. Okay. 29:20.
Jump back up to 6:31. Another IO line was established on the opposite tibia on the left side. And then another 3 rounds of epi, and then arrival at the hospital.
What was the arrival time at the hospital?
At destination was 6:45.
And what hospital was that again? I'm sorry.
Good Samaritan Medical Center.
There's a term that you use in your reports called, and I'll probably butcher this, but asystole, is that correct?
Yeah, asystole is going to be a cardiac rhythm where there's no electrical activity in the heart and is referred to as flatline.
What, if any, observations did you make in your treatment diagnosis in regards to Mr. O'Keefe as far as asystole?
So that was the rhythm he was found in. Yeah, from initial rhythm, I have on the EKG at 6:32 as asystole.
Okay.
So we'd basically observe that for any changes, whether it's increase of electrical activity, regain of adequate pulses, all of that can kind of be hinted at with the cardiac rhythm. And then we would change our algorithm based on whether we go down the ROSC protocol or we continue down the cardiac arrest protocol.
And whether it's on scene or it's in the ambulance, is there sort of a division of task or a division of different skill that's being employed in patient care?
So patient care will have to do with level of training and also proximity on the patient. Where you get into the ambulance is just logistically, if you have the training, it's not a huge open ER, it's a small environment. So we try and not have people jump over each other as best as we can.
And if you recall, who was sort of doing what in relation to treatment of this patient?
So in the back of the ambulance specifically?
Yes.
Okay, in the back of the ambulance, Tim Nuttall was managing the airway. I was the team lead that was kind of coordinating all of the interventions. Matt Kelly was assisting in gathering equipment, doing CPR before the mechanical device was placed on. basically they act as an assistant to hand equipment, place things in strategic areas around so we can actually work without having to go get those physical things ourselves.
Now, as far as you indicated removal of Mr. O'Keefe's clothing once in the ambulance, correct?
Yes.
What was it about the, sort of the condition of the clothing that led to the removal of that?
So removal of clothing is actually pretty standard for any cardiac arrest, any traumatic injuries. We're basically trying to get further clues because this is all happening very quickly. So we're trying to get more evidence of why are they here. We're looking for extremity injuries, crush injuries, bruising, anything that we could document, that we could pass on to the emergency room staff and doctors.
So important.
So we would strip most patients.
And as far as were you involved personally, as far as sort of the cutting of the clothing and stripping the patient?
Yes.
And upon removal of the clothing, what, if anything, did you observe as to sort of the condition of the clothing or texture of the clothing at that point?
Condition seemed pretty well intact, but just wet and cold.
And what, if any, relationship would the wet and cold clothing have to any of the diagnoses that you were running through in regard to this O'Keefe?
It would really just be the exposure to the weather would be our biggest trigger off of that, or if you had protruding injuries through the clothing, compound fractures, things like that.
Yep.
The clothing was intact, but we knew it was wet, it was cold. So as we strip things off of him, we can see underneath basically if there are any not every fracture breaks through the skin, not everything causes obvious things, obvious signs. So as we strip the patient, we can begin to further assess.
Okay.
Take you back just for a second to outside of the ambulance.
Yep.
What, if anything, specifically were you?
Guys, I don't know about that. Okay, so I do know about that. So his clothes are wet and cold. We get that. But a description would have been, in my opinion, that we saw that there was blood on Officer John O'Keefe's clothing, correct? We saw that there was vomit on Officer John O'Keefe's clothing. We saw that when it was cut, that those fluids were present. It wasn't just being out in the rain. So description matters. And I wonder what else. I would love to see that documentation. Mr. Yannetti, call me. Let Nurse Kim help you out. Intern, I'm right here. So I wish I knew what was going on there. And also, sidebar, has anybody ever gone out in a cold snowstorm, right? We're out in the snow. Your jeans, in my opinion, denim gets hard. Denim freezes. So that's weird. That's weird to me that he was out in 18 to 22 degrees for 6 hours. Your shit would have been like a board. You know what I'm saying? Like you would have had more, like the fibrins would have been harder. Do you know what I'm saying? I don't know.
Were able to observe with reference to any injuries Mr. O'Keefe had sustained?
Injuries are pretty tough to see outside of the ambulance just due to the weather, due to the lighting. We have seen lighting on the ambulance as well, but
let me ask you this, as far as what, if any, difference did you know between the lighting in the back of the ambulance versus when you were with Mr. O'Keefe on the ground?
So he was still out in the weather at that point, so bleeding wasn't really obvious at that point. As soon as we get him into the back of the ambulance, then we start noticing hemorrhage from different areas of his body.
Woo, woo,
And
woo, it's happening.
Hemorrhage from different areas, which areas specifically?
So mostly from his mouth, his eyes, nose. Yeah.
Oh my God.
And just to be clear for the record, when you use the term hemorrhage based on your training experience, what do you understand that?
Bleeding, external bleeding.
Now, you mentioned that there was some suctioning of Mr. O'Keefe's airway. Is that correct?
Correct.
Okay, babes, I'm so sorry. I'm stopping it again. I just wanted to say to you that when I heard this initially, I said, oh shit, we've got an active bleed. We wouldn't have an active bleed for a patient who had been struck by a motor vehicle at 12:30 in the morning, and now it's 6 o'clock in the morning, and he's being provided, life-sustaining measures. That does not make sense to me. Additionally, guys, when I tell you that somebody is having eye hemorrhaging, nose and mouth, it is imperative that we remember the testimony of Dr. Renee Stonebridge that we broke down yesterday when we talked about the catastrophic brain injury that Officer John O'Keefe sustained. This was not someone being struck by a vehicle and landing in one place on their right occiput, causing a 2.5-inch laceration. That does not medically compute. You do not have subarachnoid hemorrhaging to your frontal lobes, to your left lateral planes, to bilateral temporal lobes. Take a moment, and I'm so sorry, I don't want you to get queasy, okay? But the description that the incredible, badass, green vixen, aka our skull sleeve princess, Dr. Renee Stonebridge told us, was some of the most difficult testimony that I have listened to in any trial. He was the trauma that he went through does not align, does not add up, and does not make sense with a one-time impact from 6 feet to the ground and hitting your head on frozen ground. It does not work.
And what, if anything,
God bless him.
specifically was suctioned from Mr. O'Keefe's?
Suctioning from the airway was mostly blood, sputum.
And as far as how much, what if anything you have to sort of measure how much blood was suctioned out of Mr. O'Keefe's airway?
So we have a canister that has marks of milliliters, so we can determine as we're suctioning how much is in that container at different times.
And about how much, based on that, was suctioned from Mr. O'Keefe's airway?
So the initial suctioning with the rigid tip was about 150 milliliters. And subsequently, so that would have been above the airway in the mouth in that type of area. We established the intubation, and then deep suctioning with that soft tip through the intubation tube would have been another 50 milliliters of fluid.
We're looking at 200 cc's, guys.
Now, with reference to, you mentioned some observations in Mr. O'Keefe's back, correct?
What's that? Sorry.
You mentioned some observations you made earlier in reference to Mr. O'Keefe's back.
Yes.
And what were those again?
So that would have been redness of the skin and the posterior of the body.
What, if any, significance does that have to you as far as your observation?
So redness from the skin, if it's general or across the body, can mean certain things. If it's just a particular area, and due to the fact that it was cold outside, that would have been the initial stages of frostbite or exposure to cold.
On his back.
And as far
On
as
his
the
back.
remainder of Mr. O'Keefe's body,
On
what, if
black
any,
stuff.
other observations did you make? In which areas did you make those observations?
Oh, wait, let him talk.
With regard to the initial state.
So for as far as the cold exposure, cold exposure, we're looking at the most exterior parts. Extreme cold exposure can lead to frost nip and frostbite in different areas. The first affected areas are going to be your fingers, your ears, your nose, your toes, that type of. So that was a cold, waxy, pale, stark white.
Oh, sorry, guys. Hello?
Substance, basically, or condition of his skin.
And
Wait, what?
on each of those areas that you just described?
Love of God. Hold on, guys. I'm sorry.
Cold exposure, we're looking at the most exterior parts. extreme cold exposure can lead to frost nip and frostbite in different areas. The first affected areas are going to be your fingers, your ears, your nose, your toes, that type of. So that was a cold, waxy, pale, stark white substance, basically, or condition of his skin.
And on each of those areas that you just described?
Yes.
Okay. Okay.
Now,
This is why we do this, babes. Love of God and all things good and holy. Okay. Okay. I thought that they didn't even mention this. So this is why we are doing we are watching this together. We are blacking out. We potentially are pirouetting on Pluto right now. Okay. Everybody, I need you to just emotionally feel me, hear me, see me when I tell you that there is not a way in which we're going to make sense that Officer John O'Keefe was in the early beginning stages of frost nip, right? Not even frostbite. He's paler, right? He has white on his tips. Okay. Oop, where is she? White fingertips, a little white on your nose, on your ears, and on your toes. He was in 18 to 22 degree temperatures. And guys, he was dressed in a hoodie, an orange shirt, and dungarees, jeans, okay? As Nana Phyllis used to call them, put your dungarees on, okay? What are we doing? He did not have a hat. He like a winter hat. Yes, I know he wore a hat. Don't come for me. He did not have a winter hat. He did not have earmuffs on. He did not have gloves. When you're sitting at home and you're listening to Cindy fucking Fitzgibbon tell you how to dress in the winter, if it is under 32 degrees, often she will say a little warning to you. Within 15 minutes of exposure, you can begin to get frostbite. Please be careful. Make sure that you have your little gloverinos on. Make sure you have a hat and mittens on and your earmuffs. Being out in that exposure for almost 6 hours would have resulted in Officer John O'Keefe having at least some area of necrosis, meaning death, okay, of the tissue. Because he's in an actual friggin' nor'easter. It's happening. It's starting. The wind was howling. Let's be Karen. The wind was howling. Remember that descriptive word? I didn't love that. I didn't love that part of the 2020, but that was her descriptive words. With wind chill, temperatures, and snow, you would not be in initial stages, in my humble medical opinion. If you were out for the time that the Commonwealth is alleging you have been out in the elements, dressed the way Officer John O'Keefe was.
sort of up in the area of Mr. O'Keefe's head, you mentioned some bleeding from the eyes and the nose, correct?
Yes.
As well as his mouth.
Yes.
And beyond that, what if any observations did you make of any other sort of injuries to his head or his
So his eyes were pretty well swollen. We were trying to clear areas of blood to figure out if there were any contusions around the head. I believe there was a contusion on his forehead. Also had some markings on his extremities as well.
And just as far as your understanding, based on your training experience, when you use the word contusion, what do you understand that?
Bruising.
And before we get to the extremities, what if any observations?
Bruising to the
as far as
forehead.
Mr. O'Keefe's
Interesting.
Abdomen we noted as significant as distension or swelling of the belly.
And what, if any, significance did that have to you in regard to Mr. O'Keefe?
It's another of our detailed assessments. We go through the body in a more detailed way to try and find more clues that we can pass on for the assessment. Distension in the belly could be due to trauma or bloating. It could be, those are usually our biggest triggers for distension.
Well,
You
Andy had,
mentioned, as far as the extremities are concerned, what, if anything, did you observed as far as injuries to Mr. O'Keefe's concerned?
So we're looking at, so we had the cold, rigid fingers, hands, feet, then we had multiple dry blood lacerations to the right arm.
Woo. Hold, please.
Recall,
Cold, rigid hands and fingers. But we were talking previously about pliability in the beginning of testimony. Okay. And that abdominal distension is classic, guys. That is, you know, especially end of life, you are distending. So, but okay, keep going.
Specifically, where on Mr. O'Keefe's right arm?
Would have been his upper arm.
Dried blood.
And you mentioned dry blood, is that correct?
Yes.
So these were not actively bleeding at the time that you observed them?
No.
His arm was not
Now,
actively
as far
bleeding.
as being dried blood versus actively bleeding, what, if anything, does that indicate to you as far as sort of timing?
So we had active bleeding from other areas in the body. So the fact that it had already stopped and clotted, I would assume that would have been several hours before the incident that led him to be there, but I would guess earlier in the evening.
Babes, that's big. This is big doings. This is ding, 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 alarms, alarm, alarm. Okay. Mayday. Why don't I have, okay. We now have, again, our head lead paramedic, okay, firefighter, paramedic, Anthony Flematti, telling us that Officer John O'Keefe's arm, the abrasions to his right upper extremity had dried blood, but we did have active bleeding in other areas. How would we have active bleeding in other areas? How? He's been out on a lawn, God bless him, for almost 6 hours. Allegedly. Commonwealth theory, remember, they're telling you, was struck by a vehicle at 12:30 in the morning. 12:45 initially, but, you know, everybody gets a little something wrong. Fuck them. So at 12:30, Karen allegedly homicidally strikes Officer John O'Keefe. He lands approximately 10 feet into the lawn per Flematti. We're going down Flematti and Commonwealth, okay? And now we know that he had dried blood on his right upper extremity, but was actively bleeding. Now, remember, babes, what did I tell you? When you are going through a huge trauma, the cold is going to retard, not retarded, retard, stop, slow, back, right? Make, like, we're going to have vasoconstriction, not dilation. So anything that would have been working or would have been pumping prior to Officer John O'Keefe. Officer John O'Keefe doesn't even have a heartbeat. He's in asystole, allegedly, but he's actively bleeding. Okay.
Now, as far as the history is concerned, your attempts on scene, and then what, if any, attempts were made subsequent when you were in the ambulance to obtain any sort of history of how Mr. O'Keefe came to be there, or what, if anything, causing injuries you observed?
Once we get the patient into the ambulance, there was no family, no bystanders in the back of the ambulance, so then it's going to be solely based on physical assessment.
And within sort of the team of firefighters that you had, who, if anyone, did you direct to try and obtain that information while you were in the back?
So that would have been Katie McLaughlin.
And what did you ask Mrs. McLaughlin to do?
So Katie was one of our senior paramedics at the time.
Yes, Kimmy loving stuff. You're absolutely right. CPR absolutely does. But your paramedic would know that. Your EMT firefighter, ALS certified, would not have written active bleeding, right? That would have been resuscitative event related bleeding. That would have been documented differently. Of course, when you are having, when you are completing and you are pumping a heart for your patient, when you are doing quality CPR, yes, you are having your blood, right, be pumped for you. But the fact that he had areas that were not actively bleeding and areas that were actively bleeding is odd. It is an odd finding.
So we had enough skilled hands working on the patient at that time. So to direct her, I wasn't able to get as much information and still had a skill to do, or still had a task to do, to run the cardiac arrest. So I directed Miss Reed over to Katie to try and gather more information
Not pushing Karen.
as to why they were there. If you could get any more information about who he was, events leading to the injury, how long he was down for, any type of information, and then moved on to the patient at that point.
And so Firefighter McLaughlin is having this conversation outside of the ambulance, is that correct?
That's correct.
This is going on while you're inside of the ambulance actively treating Mr. O'Keefe.
It was a very quick process. So I start the conversation, wasn't productive, wasn't moving forward,
No,
moved her over to
no.
Firefighter McLaughlin.
No. Okay, so this wasn't while he was working on Officer John O'Keefe. This is when Anthony Flematti was telling us that he was on his way to get to Officer John O'Keefe with his equipment. So now we knew that he said that he spoke with Karen, and Karen said, I hit him. Oh God, I hit him. Different terminology, different way that was heard by other witnesses. However, he went to Karen thinking that she allegedly would know the most information, even though she was the most hysterical on scene. Now he says this was very quick. He gently placed Karen with Katie McLaughlin, and this was very quick as it happened. Okay. Tell me more, sir.
Continued on to the patient, and then started treatment, moved the patient in, and then Katie came into the back of the ambulance to help. So it was a very quick process.
Now, as far as Mr. O'Keefe's eyes were concerned, what, if any, observations further did you make as far as Mr. O'Keefe's eyes?
So both eyes were swollen and bleeding.
What, if any, observations were you able to make of his pupils?
I'm sorry, what?
Pupils?
Pupils. So I've documented as 4 millimeters and non-reactive.
Yeah.
What, if any, significance is those observations?
4
4 millimeters non-reactive.
So we're looking for equality between the two. So signs of bleeding can be demonstrated by unequal pupils, or if they were restricted, could lead us to believe it was as a result of an opioid interaction. But we're looking at whether they react to light as well. If there's brain activity, if there's still something causing the body to react, you'll have some type of pupillary response. So we shine light, there was no response, so it was fixed and at 4 millimeters.
I said that.
Now,
I
at some
said
point,
fixed. You didn't say fixed.
you leave the scene en route to Good Samaritan, is that correct?
That's correct.
Okay. And who is continuing treatment of Mr. O'Keefe in the back of the ambulance during transport?
So back in the ambulance and transport, then Firefighter Kelly, Firefighter Nuttall, and myself.
And who, if anyone, was driving the ambulance between Fairview and Good
Not
Samaritan?
all.
So that'll be determined by basically just positioning on the engine. So the step driver for that position would then drive as the detailed person over to the ambulance, and that was Firefighter McLaughlin.
Now, during the transport from Fairview to Good Samaritan,
Sorry, babes, we got to do it one time. Who, if anyone, was driving the ambulance?
Mr. O'Keefe's eyes were concerns. What, if any, observations further did you make as far as Mr. O'Keefe's eyes?
So both eyes were swollen and bleeding.
Swollen and
What, if any,
bleeding eyes.
observations were you able to make of his pupils?
I'm sorry, what?
Pupils?
Pupils. So I've documented as 4 millimeters and non-reactive.
What, if any, significance is those observations as far
Yeah,
as
we know
4
this.
millimeters
Sorry.
non-reactive?
So we're looking for equality between the two. So signs of drive as the detailed person over to the ambulance. And that was Firefighter McLaughlin.
Oh, God, I
Now,
missed it.
during the
All right, 43. God, it's just so painful to hear Lally again and again.
Bleeding can be demonstrated by unequal pupils, or if they were restricted, could lead us to believe it was as a result of an opioid interaction. But we're looking at whether they react to light as well. If there's brain activity, if there's still something causing the body to react, you'll have some type of pupillary response. So we shine light, there was no response, so it was fixed and at 4 millimeters.
Now, at some point, you leave the scene en route to Good Samaritan, is that correct?
That's correct.
And who is continuing treatment of Mr. O'Keefe in the back of the ambulance during transport?
So back of the ambulance and transport, then Firefighter Kelly, Firefighter Nuttall, and myself.
And who, if anyone, was driving the ambulance between Fairview and Good Samaritan?
So that'll be determined by basically just positioning on the
Well,
engine.
Lally.
So the step driver for that position would then drive
Who, if
as the
anyone,
detailed
was
person
driving
over
the
to
ambulance?
the ambulance. And that was Firefighter
Just,
McLaughlin.
Now, during the transport from Fairview to Good Samaritan, what, if anything, are you and the other firefighters in the back of the ambulance doing as far as continuing treatment of Mr. O'Keefe?
So we started transport at 6:27. So between 6:27 and 6:45, treatments included epinephrine, additional suctioning, managing the airway, placing another intraosseous line, and then 3 additional rounds
I
of
placed a second.
epinephrine while the mechanical CPR is continuing CPR.
And during the course of the transport, what, if any, changes in Mr. O'Keefe's status as far as the cardiac arrest or breathing occurred during the transport?
No changes.
No changes.
Now, that time that it took to get from Fairview to Good Samaritan, is that sort of a typical transport time?
Not normally. Due to the weather, it was pretty slow driving. Even though the ambulance was a smaller vehicle than the engine, slow transport compared to normal.
And during the course of the transport, what, if any, communication are you having with Good Samaritan in regard to Mr. O'Keefe and his eventual arrival there?
Every medical that goes on, we try to give the hospital staff a heads up, basically, of what's coming in. We'll have different alerts that we would give them, whether it's a cardiac arrest, a stroke, a STEMI, to have the certain appropriate teams come in and be ready, whether it's a trauma alert. There's different specialties within the hospital that'll treat those different particular cases. So we call them 5 to 10 minutes prior to give that team time to get down into the emergency room to get ready to work.
When you arrived at Good Samaritan, who, if anyone, were you met by and sort of what happened with regard to Mr. O'Keefe?
So we're continuing interventions from the ambulance through the bay into their code room. We're then met by registration, a registered nurse, and the doctor that took care of the patient, as well as a team of other assistants and CNAs.
And where do you physically go with Mr. O'Keefe, or how does that work?
Yep, so that's referred to as a transfer of care. So there's different people, like I said, it's a team base where different people are in charge of different things. You'll have the nurse in charge that's in charge of documenting our interventions that have been done so far, time of down, the patient was down, and then she starts documenting all the different interventions that were done by the hospital staff as well. You also give a report to the doctor, who's then taking over as lead for the cardiac
heroes
arrest.
of all hospital staff.
They're going to start issuing
nurses.
orders for the
Thank
patient
you,
and treatment.
nurses. Let it be
And then you have
Nurses Week.
registration that will get the
once a
information
month.
to register the patient that they can tie all of their interventions to.
And during that sort of process of exchange of information and things of that nature, what, if anything, did you learn in regards to the sort of core body temperature of Mr. O'Keefe?
So to add that assessment, I believe he had a core body temperature of 80 degrees.
What, if any, significance does that have in regard to sort of the typical core body temperature?
Typical core body temperature is going to be in the high 90s, where body temperature being at 80 with a rectal temp or core temp is going to be extreme hypothermia.
Extreme.
Now,
But that is normal, guys, because you would drop a degree. I don't even know. There's like calculations,
for a certain
but
amount of time, correct, before you clear?
Correct.
And at that point in time,
there are calculations to figure out how fast somebody could in theory, but every person is different. So yes, he's an extreme hypothermia. If he has a core rectal temp of 80 degrees upon arrival at Good Sam, okay? But we have to remember that Officer John O'Keefe was out in 18 to 22 degree temperatures with high winds, with precipitation falling from the sky, allegedly. And that doesn't make sense to me that if he is not wearing a coat, no mittens, not well dressed for the weather, that could have happened. I truly believe that could have happened in a short period of time.
while you were at Good Samaritan, that initial time, what, if anything, did you learn as far as Mr. O'Keefe's status or what had happened?
So as we talked about before with the hypothermia and the extreme cold, they're going to work that for an extended period of time. Most cardiac arrests, I will try and hang out by the patient or in the area. As new staff come through, different things are found. The doctors and nurses might have follow-up questions. So I try to stay available as an asset that they can bounce those questions off, at least for 10 or 15 minutes afterwards, to make sure the whole process is completely transferred from all the interested parties.
And during that course of time, what, if anything, did you learn as to the eventual status of Mr. O'Keefe?
We didn't learn anything while we were at the hospital. We then cleared the hospital, returned back quarters to decon the ambulance and to replenish all the equipment that we had used, get back in service, and move on with the shift.
At some point during the course of the shift, did you have occasion to go back to Good Samaritan?
Me personally, no. It would have been for an additional medical call if there was any calls for service afterwards.
Did you recall whether or not you went back to Good Samaritan for any additional medical calls or anything of that nature?
I don't recall.
So if I could direct your attention to the screen just over there. Ms. Gilman, if I could please have exhibit number 9.
What are we doing? Oh, for the love of God, Lally.
And so directing your attention to what's been previously marked as exhibit number 9 up on the screen, do you recognize what's in that photograph?
The house.
Is that the house?
Yeah, that's the house. I don't care about anything unless.
Mr. O'Keefe's lying on the ground in the first row.
Yes.
And using that laser pointer, could you direct the jury's attention to where in this photograph you observed Mr. O'Keefe initially arrived?
Initially arrived would have been
Uh-oh. Hello?
in this area here.
Okay.
Thank you.
I can't see anything.
And just one moment, Your Honor.
Yes.
Oh, Lord, we've got cross.
nose?
So due to the bleeding that was coming from the orifices, trying to clean the area and find exactly where it's from is sometimes difficult. So we can just say it was bleeding in that area.
Okay, so you can't define, as you sit here, you don't remember if it was bleeding from the nostril or from a laceration on the nose?
I believe it was a nostril.
Oh my gosh, what is happening?
Are you saying that there was no laceration on the skin of the nose, or you just don't recall it?
On the top of the nose, no, I don't.
Oh my gosh, guys.
Ambulance as you were approaching, correct?
Yes.
And you're sitting on the right side, which means you're sort of the furthest away from that figure
I'm so
from the perspective of
sorry.
the ambulance.
And the ambulance, yes.
And you had no problem making out that figure in the snow?
The figure in the snow, we had a good distance between the ambulance and the engine, so yes.
Okay, and you indicated that the figure in the snow was on top of the snow, if you will, with some snow accumulating up the body of the individual.
Yes.
But he was not covered in snow.
No.
There wasn't like a mound of snow over this figure.
There were mounds of snow in the area, but not over the patient. Due to the wind, there were snow drifts in the area.
And his clothes were dark as compared to the white snow.
Yes.
I want to ask you a couple of quick questions about some of the last conversation we had with Mr. Lally about the injuries. You did note
Oh, for the love of God
Mr.
and
Lee had a
all things
laceration
good and
over
holy.
his right eye, correct?
No, over his right eye,
Over his right eye.
there's a contusion over the eye,
Okay, and your definition of a contusion is,
bruising.
was it also swollen?
There was swelling around the eyes and a little bit of contusion and bruising around.
Did you see an actively bleeding laceration over his right eye?
I don't recall.
You don't remember that?
Okay, that's problematic.
What about his left eye?
All right, now Lally, I mean, now we're on AJ. I have to turn this back to normal because Lord help us. But babes, remember he said that he saw a contusion over the eyelid, which is a bruise, okay? That's pooling blood bruising, but not a cut, not an open area. That's different because we know from Irene Scorti-Bello that there was a cut above his eyelid, and that there also was a cut next to his left nostril. Right eyelid, left nostril. Interesting. Oh, please, for the love of God.
Both eyes were pretty well swollen shut.
What about not from the nostrils, but on the skin on the nose? Did you note a laceration or multiple lacerations on the nose?
So due to the bleeding that was coming from the orifices, trying to clean the area and find exactly where it's from is sometimes difficult. So we can just say it was bleeding in that area.
Okay, so you can't define, as you sit here, you don't remember if it was bleeding from the nostril or from a laceration on the nose?
I believe it was the nostrils.
Okay.
That's wild.
Are
That's a
you
wild take.
Are you saying that there was no laceration on the skin of the nose, or you just don't recall
On the top of the nose, no, I don't know.
it? I'm sorry,
On the top of the nose, I don't recall.
you don't recall. Okay. With regard to his abdomen, you indicated that it was distended,
Yes.
a medical term for swollen.
Mhm.
You said that that could be from trauma or it could be just bloating, correct?
Correct.
Did you notice any contusions on his abdomen?
No.
Any skin that was abraded?
No.
Or cut?
No.
So there was no bruising, no contusion, but there was a distension, correct?
Yes.
So there was no visible trauma to the abdomen.
Visible trauma doesn't really matter to internal trauma. It's not always indicative one way or the other.
So my question was, did you see any visible trauma on his abdomen?
No.
Okay. But you did.
He is right, of course, that visible trauma, that what we can see is not always indicative of what is going on internally. We do know that there was petechial hemorrhage internally regarding the hypothermia, the diagnoses hypothermia that Officer John O'Keefe had, that contributed to his death along with the blunt force trauma to his head. Those were his cause of death, guys. So that's very important. Now, let me tell you something. My stupid internet, this internet right now is saying that I do not even have very good service. So if this starts to act wacky, we're going to have to shut this off. but us getting through at least direct testimony is huge, babes. And we have seen what we have seen. We know damn right well. We know that the defense did a beautiful job. We know that Alan Jackson, 100% asked all the questions that we needed to know. But going through and going back through Adam Lally's direct testimony versus his cross, this is huge. This is bringing us back, and it is getting us right in the zone, right in the medical crux of this case. Because at the end of the day, that is what matters. Facts matter. Journalism. Karen's life, Officer John O'Keefe's life, the two parties in which we care for, that we continue to fight for, that we say, something is off, that the Commonwealth's theory does not work, in my humble opinion, and it never has. Medically, everything else, take it out of the equation and look at this and look at the injuries that were sustained by Officer John O'Keefe. Look at the measures that were taken by trained medical professionals. God, we're going to do Justin Rice. No, we're going to do Flematti next, and then we're going to do Justin Rice. We don't really need anybody else. But Justin Rice, and potentially I'd like to go through the BAC testimony, because I do want to go through that, guys. And we've got, only, I think it's 3 months to trial, till retrial, if, in the event that there is a retrial. But this is where we gather ourselves together and say, okay, we're really on top of every piece of medical information. Dr. Renee Stonebridge, top tier, 10 out of 10, would recommend, and we need to cross next time. Flematti, I will say this. I think that Anthony Flematti is a wonderful, wonderful, very trained. So is Timothy Nuttall. These are very trained individuals. I'm going to say something, and it's going to be controversial. Get ready. Gear up. Grab your pearls. Clutch them, babes. I have been under the assumption, and it has always been my thought process, that Timothy Nuttall and Anthony Flematti did not hear Karen Reed say anything about hitting anything. I believe that they believe it, that they believe it's a core memory, because they heard a woman say it, but I do not believe that it came from Karen. And I believe that they were incredibly busy focusing on what their job was, which was to provide life-saving measures and resuscitative efforts to Officer John O'Keefe. Hearing a side conversation that happened in, as he described, seconds, is abnormal. You wouldn't technically or typically, I can remember big events that happened in any code that I've ever been in. You know what I've never remembered? A fucking side quest. You know what I'm saying? Because if you weren't getting information out of Karen Reed, including but not limited to, I'm not getting his age, I'm not getting his demographics, I'm not getting his his residence, I'm not getting his birth date, I'm not getting, his fucking allergies. I'm not going to sit and wait and listen when you need to get to him to hear a sidebar, in my opinion. And you don't have to, guys. I get it. If you think, everybody can believe whatever you want to believe. But for me, it is like, I believe that he heard somebody talking about it, but he didn't. I think that he was so busy, so focused, laser, You are laser focused. You are adrenaline dumping. You are dropping your adrenaline like a son of a gun. You are in fight or flight. And you are working to save another human being's life. I'm not hearing dick shit. I'm deaf, okay? I'm deaf during that. Because I am only focused on what I am doing. Is how my experience has been.
Did note that it was bloated.
That it was distended, yeah.
Okay. I want to talk to you for a second about, if I could shift gears, about the conversation that you indicated to Mr. Lally that you had with Ms. Reed. You were also asked about that conversation at the grand jury when you testified, correct?
Correct.
You testified that as the lead paramedic, you were specifically trying to get as much information from my client, Ms. Reed, as you possibly could concerning the victim and how the victim ended up being there, correct?
Correct.
You indicated in no particular order that you asked questions like, how do you know him, correct?
Correct.
How did he get here?
Correct.
What happened?
Correct.
Is there any additional information you can give me about what happened to this person?
Correct.
Okay, so that was a conversation that you were personally engaged in with my client in order to gather as much data, if you will, about what you were dealing with, correct?
Correct.
But your focus was, when you first arrived, your focus is, I need to attend to the patient, correct?
Correct.
Like, conversations notwithstanding, I need to deal with what's in front of me, which is
a medical
an
professional as
unconscious
well.
man in the snow,
Correct.
dressed inappropriately
Correct.
and possibly freezing to death.
Correct.
But you did say that you had enough of a conversation with Ms. Reed that she answered you and said something to the effect of, I hit him, oh my God, I hit him.
Correct.
So then you followed up on that conversation, correct?
As much as I could, yes.
As a matter of fact, you said that you asked her additional elaborating questions.
Correct.
Well, did you hit him in the face? Or did you kick him? Or did you hit him with your hand?
Yep.
Okay. So that's a conversation that you're having with Ms. Reed face to face.
Correct.
You're talking to her, you're looking her in the eyes, she's looking you in the eyes, you're standing still, and you're attempting as best you can to converse with this woman so that you can gather as much information as you possibly can as you attend to the victim.
Correct.
You indicated that that conversation lasted long enough that the conversation was frustrated by the fact that you weren't getting information that was helpful to you. So you turned that conversation over to Katie McLaughlin.
Objection? Sustained. Ask it a different way.
Sure. Did you have, was your conversation in some way in your mind, and when I use the word frustrated, I mean, it was just, you weren't getting the information that you were seeking, correct?
It wasn't productive.
Okay, better way to put it. I'll use your word. That conversation was unproductive enough that you then moved the conversation over to Ms. McLaughlin, correct?
Correct.
Firefighter McLaughlin. And once Firefighter McLaughlin engaged Ms. Reed, you then began to attend to the patient again.
So the patient was already being treated by the other personnel on scene.
Okay.
I started the conversation, realized it wasn't going anywhere. I had other responsibilities. So regardless of how they ended there, they still needed treatment
Of course.
and transport. So that began my priority and moved her over to try and get as much information while treatment was being done.
What part of the treatment were you responsible for?
All of it.
Sorry, that's a great answer to a very vague question.
Yep.
What physically were you doing with Mr. O'Keefe?
In which particular moment?
When you first arrived and attended to him and physically touched him, in other words, were you the airway person? Were you the cardiac person? Were you doing chest compressions? Were you squeezing the bag?
I would have been doing chest compressions initially until I could delegate that task to somebody else.
Okay. And chest compressions, I'm going to butcher this because I've never been trained other than my little toddler. They look a little like what I'm doing now, correct?
Correct.
and I indicated palm over one palm over my hand, arms extended, and you can see my shoulders moving up and down in a rhythmic fashion, correct? So if
As an ambulance
Yes.
is right behind. Perfect timing, if you will. Also, babes, just I wanted to give you one update. Random side note is that one of my favorite songs in the whole entire world right now is Chapel Rowan Pink Pony Club, which I am going to be using for any cardiac event moving forward. Okay, so it's a perfect, I think it's 100 beats per minute. So we're gonna pink pony girl, and you dance at the club, oh mama. Ooh. Okay, sorry.
What were you wearing?
What was I wearing? My uniform.
Didn't expect that one, did you?
That was a different one. Heavy winter coat,
Okay.
uniform.
Do paramedics wear sometimes yellow, bright yellow for safety?
Yes.
Were you wearing a bright yellow heavy winter coat?
I don't recall. I have a few different coats.
Got it. Do you remember what Miss McLaughlin was wearing?
I don't.
Oh, this is
Okay.
coat tape.
Um,
This isn't important really for us as medical professionals.
that conversation that you had with Miss Reed at the scene,
Well, this is.
that had to have lasted, I'm not guessing it was very long, but it had to have lasted a minute
At most, yeah.
at most. Once you finished your conversation with Ms. Reed, did you then start attending specifically to the chest compressions and the high-level CPR that we've heard so much about from your colleague?
Yes.
As you're doing the CPR on the scene, that high-level CPR, high-quality CPR, was Mr. O'Keefe then moved to the scoop, which would then facilitate getting him on a gurney?
Correct.
That gurney was then moved between a couple of patrol cars, cruisers, and into the ambulance, correct?
Correct.
Once you were in the ambulance, the first priority is to get this person warm. Is that right?
First priority is always going to be CPR. The secondary would be getting them warmed up.
Okay. So obviously, when you got into the ambulance, you would shut the doors. There's a heater on in the ambulance.
Yes.
You never came back out of that ambulance after you got Mr. O'Keefe into the ambulance, did you?
No.
Okay. And you were in there with firefighter Nuttall at the time?
Nuttall and Kelly.
And firefighter McLaughlin was outside the ambulance doing whatever she was doing.
Correct.
Okay.
Initially, and then she came in afterwards to
Obviously.
assist. Yeah.
And did I hear you correctly, when firefighter McLaughlin got in the ambulance, she took over the driving responsibilities?
So there's two different compartments. They're not connected. There's a little window between the two areas. So she assisted with interventions in the back. And then after we had established everything we needed to on scene to begin transport, she then got out and then started driving.
Got it. Thank you. I'd like to play, but first I'd like to have marked, I think it's already been marked, Exhibit 379. It's a video, a snippet of a video. It's probably 3 minutes long. It's not that long. I'd like to play that portion of the video for you. And when it's done, Firefighter Nuttall, sorry, I'm looking at the wrong notes. Firefighter Flematti, which is not that easy to say.
Did a great job.
I'm going to ask you to show me exactly where on the video, if you can, that you had this conversation
For the laser pointer?
with my client. Yes, you can use the laser pointer as you wish.
Jackson.
This is just to orient you, if I may, Your Honor. The top, let me see if I can do this.
Okay, this is Officer Saraf dash cam. This is good, guys.
The top is a dash cam from one cruiser.
So I'm gonna see counsel at sidebar for a second.
Oh, for the love of Christmas, of course you don't want to show this, because this is when, guys, we have the understanding that perhaps it was not done and he was not speaking with Karen at any time.
Actually, I need to see counsel at sidebar again.
Let's have a moment. Let's have a moment and remember this. Hi, OnlyFan. Look at you. You beautiful little son of a gun. The only fan I love. Okay? Let's how I'll get a help the defense fund. Get a little OnlyFan account. Look at Mr. Yannetti. All right, we're going to stop after this, guys, and then I'll answer questions. And then we have been the best students ever today. I am so proud of you. You are the smartest. You are the prettiest that ever lived. Thank you for answering my FaceTime. Look at Karen. This makes me sad. Okay, what are we doing? I thought it was 3 minutes long. 6:13 a.m. They arrive on scene when? 6:13? No, 6:15. Or 6:13. All right, we see the stretcher. Wait, is that Kerry or is that Jen? Chad, is that Kerry or is that Jen? It's Jen. Dewey, thank you. All right, there's Sirach. We know him. He has a different body structure than others. He's a little bit of a tall, portly man. He likes his groceries and Dunkin' Donuts. Now, we just saw all of the paramedics walk by. Where was the conversation? Uh-oh. Oh, that must be Mulaney, the little one. All right, we've got, oh, Jesus. Oh, God, help us all. Oh, there's Carrie. That must be Carrie. Carrie's taking out a snow brush to, okay, in the back of the windshield.
That's the extent of the, or approximately the extent of the length of the video. The clip that I
6:13 to
was going
6:16.
Okay.
So we didn't
All right.
see any.
So we'll take a
conversation.
10-minute recess.
Thank you, Your Honor.
Court will rise for the submission of briefs.
Well, that's problematic. We'll end it on the OnlyFan, guys. What do you guys think? Tell me everything. Tell me all of your thoughts. I find that very interesting, guys, because I truly believe that Anthony Flematti has that memory. He has that memory. He heard it at some point. But when he said it occurred, and now that we've seen the footage of when he alleged that that everybody was bringing the equipment to go and get Officer John O'Keefe and to go and assist, that occurred. But there is no interaction between Karen Reed and Anthony Flematti. And I can feel it now. I'm going to get a lot of comments and they're going to say that C word, Nurse Kim. She's talking and having opinions. Yes, she does. Oh, look at this. Remy, thank you so much. I appreciate you. Oh, thank you so much, Candy Temple. I appreciate you. See, this is where, like, I think that it is helpful to have one of us who was watching it, was making TikToks about it. But that was like at a smaller clip. I was only doing a couple minutes at a time. And this allows us guys to have a really robust conversation and to listen to it, to dissect it, and to also break it down and make it make sense. Because these are things that is not regular in normal like conversation or life. These things don't come up for a significant amount of the population. So for us to be able to sit down and to talk to each other and to just kind of get a really clear picture of what was happening, what was medically occurring, and what was the surrounding questions that we still have as we are going into trial number 2. I have a lot of questions, lovies. Okay, now let's see. Oh, lovies. Okay, my BLT, please make your screen bigger. Oh my gosh, geez, Louise, I didn't even do that. Is this how I? Oh, hi, lovey. Screen's bigger. Okay, and oh, Jeno, thank you for being 1 month of a member. I appreciate you. And Lauren Mraz said, Kim, I think this is your niche. You should do recaps on all the various trial medical testimony. Lauren Mraz 99. I would like to do that for you, with us, all of us together. And Lisa Buckley says, please know you are so appreciated here in England. You are one special lady. Lisa Buckley, are you kidding me right now? First and foremost, I am obsessed with your bangs. You are an incredible queen with your, I believe in England, they call it the fringe. Stop it. I'm obsessed. You're beautiful. I appreciate you. And you are one special lady. Jason Smith said, if KR hit him at 12:30ish, then how is he still alive at 6 a.m.? Jason, my little Grateful Dead, you little, my king. Okay. You're right. That's a lot of question. There's going to have to be answers for the amount and injury that was sustained to Officer John O'Keefe's brain, his brain stem, his autonomic nervous system, and things shut down. He was in the beginning stages, allegedly, potentially, of frostbite. After being out for 6 hours, in 18 to 22 degree Fahrenheit temperatures with howling winds and precipitation in the form of what? A snowflake. Oh, Joseph Kane, thank you so much for becoming a new member. I love your face. And for a super sticker, you are too sweet. And then I want to see a code sheet, shocked tubed meds. Yes, Lovey. And I would like to see, I wonder if we do have, I'm going to have to go back and see, because I would like, we're going to watch Nuttall. We're going to definitely do Justin Rice, the ER doc. And I do want to go through the BAC, not the extrapolation technically. Well, maybe the extrapolation. That would probably make the most sense. And then we have, oh, thank you so much, Joseph Kane, for gifting a membership. And Glass Mama 4201 says, first of all, I love your guts. Ditto, babes. Second, you're making all of us wow. Proud AF nationwide, with your badass wound certified RN skills. Third, just medically just medically, this case is the definition of the Twilight Zone, babes. Yes, free Karen Reed. Thank you so much, Glass Mama 4201. You are an angel baby face, and I'm obsessed with you. And then, oh, my Brit happens. Thank you so much, Lovey. I appreciate you. And then, oh, Angie McLaren, are you kidding me? Stop it. Stop it. What are we doing? Get out of town. And then, please, oh, Classic Overthinker said, please ignore the trolls. You are awesome. Did you see the pic of my son's head trauma on X? So much blood. Where is OJO's blood? Hang on. If he vomited, he was alive. Exactly. This is This is very interesting testimony. So we're going to need to go back and do Nuttall, because I remember, other than the puffer coat, Timothy Nuttall was incredibly educated. I mean, I remember Nuttall as saying, like, I would want Timmy Nuttall on my team. Like, if I was in a code, I want Nuttall on the team. Okay. Very, like very pocket protector / protecting your life. Okay. I'm into it. And then Mary Malarkey, hello, my love. I can't accept the photos weren't taken at the scene and offered as evidence in trial. A woman is on trial for murder, for F6. Yes, totally agree, Mary. Hi, Cynthia, 1880. Thank you so much for becoming a member, love. I'm an oddball. Get ready. Okay, get ready, get set. We're a little bit of, I'll take you to Funky Town. Dina Bellina says, oh, thank you so much, love. Says, why didn't Karen go into the ambulance with John? That seems weird, no? Everyone knew it was his girlfriend. So, Dina, that's a great question. And yes, typically they would allow a loved one, except for the fact that Officer John O'Keefe was in an active code. And I do not think, because of them, providing that epinephrine, providing 6 different times they did throughout the entire resuscitation effort and the code of the team getting him to the hospital, and Karen being so hysterical that probably and then minutes later, after Officer John O'Keefe is removed from the scene, she gets into the car, she does a little, pull up, bitch, bang, bang, heads out, she's taken off. The Mr. and Mrs. Reed call Kerry and say, I'm going to need you to bring her back. She's got to get back to the scene. I'm taking her back to 34 Fairview so that she gets put in another ambulance. And she is transported for her own Section 12. So there was a lot going on there, but she was dropping her basket and having a full-blown, psychotic event. Not psychotic, but she was, having a little bit of a concern to herself and others. She needed to be evaluated at Good Sam Emergency Room. Ask Bob, thank you so much for being a member for a month. And Maddie Wag says, has he mentioned the giant wind in the back of his head? Who? The giant wound. There we go, babe. No, he hadn't. The giant wound, the 2.5-inch laceration to the back of the right occiput of his skull. Not a darn mention of it. Then Britt Happens said, Jen's 6:30 Huslong to die in CIKD search. Yeah, and now we know, like, that's interesting too, because we know that the boys, or not the boys, but that they left the scene at 6:27. They arrived at scene allegedly, or no, I lied. The first epinephrine was given at 6:15. They left or they were transporting at 6:27, and they arrived at Good Sam at 6:45 a.m. I don't know. And then thank you so much, the Goodmans, gifting 1 Nurse Kim membership. I appreciate you so very much. And Deidre Sargent says, did the hospital autopsy report say that John lost 3 units of blood? Did the hospital transfuse any blood? No, they did not transfuse any blood, Deidre. I remember that because he never allegedly came out of asystole, right? So you're not going to transfuse a patient if they don't have a rhythm. And 3 units of blood. I don't know. I'm going to have to go back. I know that a lot of people say 3 liters of blood that he did lose, but I don't know where the 3 liters of blood came from, other than somebody read it somewhere, but I cannot locate or confirm that 3 liters of blood was lost. And that is it, babes. Okay, I kept you too long. Look at our OnlyFans. Let's play it out. Oh, I can't because I stopped sharing the screen. JK. But listen to me. I love everything about you. You are the best humans that basically I've ever known. And I maybe don't tell you enough, but I really appreciate so much that you answer my FaceTimes when I call. You truly are my best friends from out of town. And I hope that this was at least somewhat helpful or productive or good for you guys, because I would have been watching it by myself, in the house. So hopefully if we could do one of these a week of the medical testimony, I think that would be really good for us to get up to par and prepared for retrial. Okay, guys? I love you so much. I'll talk to you soon. Bye, guys.